My name is Funmi Olopade, Olopade. I'm a professor of medicine at the University of Chicago, and I'm here in Brazil for the Female Cancer International Symposium in Salvador, Bahia. We have been having a very important meeting. This is the pre-meeting discussing how to mainstream genetic testing in oncology care. In 1997, I chaired the American Society of Clinical Oncology Task Force on Cancer Genetics Education. And my talk this morning was about lessons learned in 25 years of doing genetic testing for BRCA1 and BRCA2. We have made a lot of progress, but the progress has not reached the people that we need to reach. As oncologists, we discussed the fact that we have continued to wait to test patients when they have advanced metastatic breast cancer or when they are diagnosed with breast cancer. We discussed the urgency of trying to reach patients before they ever get breast cancer. I found my colleagues in Brazil, especially Dr. Rodrigo Gundalini, has been working really hard to increase cancer genetics education. A number of my colleagues in breast and ovarian cancer and the laboratory scientists who are offering genetic testing are all very engaged, and they want to advance this research. So I've been very happy to work with them to look at what we have learned, how we now have treatment options based on several drugs that are now approved based on the genomic alterations in cancer cells. We discussed the fact that patients who have inherited mutations have options. They may choose to have their breast removed, or in groundbreaking work that we have pioneered at the University of Chicago, and that was actually written up by Dr. Gundalini. We showed that women are compliant when they are asked to be screened with breast MRI. Many of these women who are mutation carriers are coming back every 6 months. They are not getting cancer, and they are compliant with screening. So it's really good news that women have options, and that when doctors give them these options, these women will be compliant. So I really have had a wonderful time in Brazil, and I hope that my colleagues will continue to improve their cancer genetics education, and that they will offer genetic testing to their patients. It's not just breast and ovary right now. That's what this conference is about. But we know that men who have BRCA2 mutations also need to be aware of the increased prostate cancer risk. So really, the good news is that we've made significant advances, and what we need to do is to make sure that we implement life-saving interventions in all our practices, and then we disseminate that so that everyone in Brazil will have a chance to survive breast and ovarian cancer.